Safe Supply is a harm reduction strategy that provides people with substance use disorders access to prescribed alternatives to illicit drugs that are safer and more regulated. The goal of Safe Supply is to reduce the risk of overdose and other harms associated with the toxic illicit drug market, and to connect people to healthcare services and support. Safe Supply is needed because B.C. is facing a dual public health emergency: the COVID-19 pandemic and the overdose crisis. The overdose crisis has claimed more than 7,000 lives in B.C. since 2016, and the majority of deaths are linked to fentanyl, a highly potent synthetic opioid that contaminates most street drugs. The COVID-19 pandemic has worsened this situation by disrupting the drug supply chain, increasing isolation and stress among people who use drugs, and limiting access to harm reduction and treatment services. In response to these challenges, B.C. became the first province in Canada to introduce a temporary Safe Supply program in 2020, allowing doctors and nurses to prescribe medication alternatives to substances, including opioids, alcohol, stimulants, and benzodiazepines. In 2021, B.C. announced a new policy to expand access to prescribed safer supply, with funding up to $22.6 million over the next 3 years. The new policy aims to reach more people who are at high risk of dying from the toxic illicit drug supply and provide them with alternatives covered by pharmacare. Safe Supply is not a one-size-fits-all solution. It is based on individualized assessment and care planning by healthcare providers, in consultation with people who use drugs. Safe Supply can include a range of medications, such as hydromorphone, buprenorphine/naloxone, methadone, morphine, diazepam, dexedrine, and Ritalin. The type, dose, and frequency of medication depends on the person's needs, preferences, and goals. Some people may use Safe Supply as a bridge to treatment or recovery, while others may use it as a long-term option to manage their substance use disorder. Safe Supply is not without challenges or limitations. It requires adequate training and support for prescribers and pharmacists, as well as monitoring and evaluation of its outcomes and impacts. It also requires collaboration and coordination among various stakeholders, such as health authorities, Indigenous-led organizations, community agencies, and people with lived and living experience of drug use. Moreover, Safe Supply does not address the root causes of substance use disorder, such as trauma, poverty, stigma, and criminalization. Therefore, Safe Supply should be seen as one component of a comprehensive response to the overdose crisis that also includes prevention, treatment, recovery, and harm reduction services.